Why should you call 911 if you have symptoms of a heart attack? A Umatilla man explains the well-oiled machine that helped him when he experienced chest pains.
I was at the First Presbyterian Church of Eustis and started feeling some chest pains, and then I broke out in a cold sweat, and I said, this is not normal. And so I said, well, maybe it'll just go away. And it didn't. And so after the service, I told my wife. So she said, well, I'm not driving you to the emergency room again because they lectured me last time, never do this. So someone in our church called 911, and within a couple of minutes, the ambulance showed up. After they had done their initial examinations, they put me on a gurney and loaded me up in the transport, and within just 3-4 minutes, we were at the emergency department at Waterman Hospital in Tavares. And I also know that while I was being transported, that they were in communication with the emergency department, and so I knew that there was work being done prior to my arrival.
We have an incredible relationship with Lake EMS, and we make a commitment that the patients that come by ambulance are likely very sick patients, and they need the care the fastest.
Within about a short time, I wound up in a room where the emergency department physician said, based on your history and your symptoms, we think you ought to spend the night, and we'd like to, take a look at you.
Yancey had a stent from a previous heart attack in 2002. The AdventHealth Waterman cardiac specialist determined he needed a new one.
I heard them say, okay, it's flowing now, and I said, wow, I feel better already. It was remarkable that from Sunday morning to Tuesday by noontime, I think I was on my way back home.
One of the most important reasons for a community to have a top-notch emergency department is that you have no idea when that heart attack is going to hit. And if you have individuals who are specifically trained and skilled to take care of those items, not just sort of by the seat of their pants, but number one, that they use evidence-based medicine, that they follow guidelines that are nationally based, and they do it in a way that makes the person and the family feel good about it, I think that is priceless.
Yancey agrees, so much that he's a member of the AdventHealth Waterman Foundation Board and is leading a fundraising campaign to expand emergency services at the hospital.
One of the first questions that people ask when they move into North Lake County is, what are your schools like and what's the health care system like? And we have an outstanding hospital at Waterman.
Lake County residents have a good reason to feel good about that effort to expand emergency services at AdventHealth Waterman. The $74 million construction project is underway that will more than double the size of the emergency department while adding a 4-story patient tower. Patients and visitors to the emergency department can access it temporarily through the hospital's main entrance. Free valet parking is available 24 hours a day for emergency care at this entrance. The emergency department's main entrance will reopen next month. You'll find information about AdventHealth Waterman's emergency services, as well as the expansion project, by visiting the website on your screen.